There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question: what are the best ways to manage blood pressure and hypertension if you have kidney disease? Answer by James Tattersall. The kidneys control blood pressure. If you have kidney disease, the kidneys mistakenly think the blood pressure is too low and try to increase blood pressure. They do this by releasing the hormone renin, activating the sympathetic nervous system and limiting the excretion of salt and water in the urine. In addition, if you are diabetic, the kidneys try to recover sugar filtered into the urine. A side effect of this is to also recover salt, which contributes to the body's salt overload. Salt overload, high renin levels and sympathetic nervous system activation all cause high blood pressure. The most natural way to manage blood pressure if you have kidney disease is to reduce the salt in your diet. Most of us eat too much salt anyway. Cut out junk food. Most processed or manufactured food contains a lot of salt. The safest is tea. Stick to natural foods, fresh vegetables, fruit, meat, fish, cooked at home with no added salt. However, unless the blood pressure is only slightly raised, salt restriction on its own is not likely to be enough to control blood pressure. If you are diabetic, control the blood sugar carefully. These changes are usually not enough to control blood pressure on their own. If that is the case, it is very important for you to take medicines to control blood pressure. High blood pressure will cause further kidney damage and increase the risk of kidney failure. Medicines to control blood pressure and kidney disease include: these medicines also have other health benefits, especially for the heart, and are proven safe in long-term use. Your doctor will choose the best ones to improve your overall health, depending on any other conditions you have. Most people with kidney disease take one or more than one of these medicines. Of course, the high blood pressure can be due to reasons other than, or in addition to, the kidney disease. High blood pressure is a common cause of kidney disease. So, even if you are already taking medicines to block the kidney's ability to increase blood pressure may still be high. In that case, other blood pressure lowering medicines may be required, e.g., calcium channel blockers, vasodilators. In addition, if you are curious as to why the kidney controls blood pressure and not some other organ, the kidney is the only organ in the body to receive its blood flow at the same pressure as it was pumped out of the heart. Other organs regulate their blood flow according to their needs, so receive blood at lower and variable pressure. The kidney does not need the blood. Its function is to filter the blood regardless of its own needs. The kidney actually measures blood pressure by detecting the rate of fluid filtered from the blood. Filtration is driven by pressure. If blood pressure falls, filtration also falls, and the kidney responds by trying to increase blood pressure. In kidney disease, filtration is reduced due to problems inside the kidney, not low blood pressure, so the kidney's response, to try and increase blood pressure, is inappropriate and harmful. Answer by Damiano Rusman. Why not try eating the humble cucumber, which in some countries is the most recommended natural remedy for high blood pressure? Just eating one cucumber a day is enough to lower your blood pressure, even a small one. I used to bring one to the office and eat it after lunch, but after just a few months my blood pressure is back to normal. Just don't overdo it by drinking cucumber juice, or your blood pressure will dip down fast and you will feel dizzy. Just eat it. Answer by Leanne Heisey. Usually not different from not having kidney disease, unless your estimated glomerular filtration rate (eGFR) was less than 30 milliliters/minute. In this case, no diuretics/water pills, not effective, and can make kidney insufficiency worse. Personally, it start with the angiotensin converting enzyme inhibitors, ACEI. Many of these meds depend on the kidneys to get them out of our system again, so we should start low, and raise the doses needed, aiming for a systolic blood pressure of 120,124 millimeters. Hg, diastolic greater than 70 millimeters. Hg, so not too low, since in the elderly this is correlated with more deaths from impact of achieved blood pressures on mortality risk and end-stage renal disease among a large, diverse hypertension population. If blood pressure still too high, and eGFR greater than 30 milliliters/minute, I would add a long-acting diuretic. The best documented being chlorothalidone, which in the large LHAS study see major outcomes in high-risk hypertensive patients randomized to angiotensin-converting enzyme inhibitor or calcium channel blocker versus diuretic trial did at least as good as the newer and more expensive AC ice. If this wasn't enough, one could add a long-acting calcium channel blocker e.g. amlodipine, medicine to treat high blood pressure, NHS. UK. We should keep monitoring the kidney function. Start repeating it 2 weeks after starting ACE, since in some kidney function on ACE will reverse or worsen at the beginning of treatment. In the great majority spontaneously return to the previous value. In a very small minority it doesn't, then the ACE needs to be stopped. That's why it needs to be monitored.